you guys doing? But before I jump into the actual specifics of the product itself, I wanted to understand a little bit more about what was the background about why you started this company.
It's a personal story, like many people in healthcare. So in 2012, my father had a second stroke, and I had been working in healthcare already for quite some time. At that point, I decided that I wanted to jump on the problem it was causing, and one of the key problems here was to be able to anticipate when it could happen again, as well as to anticipate if his state was improving or worsening. And the what became obvious to me at that time was that the IoT, the sensors, the smartphone was still something being totally underused and was on its way to becoming something massive to make a difference in the life of those patients and in the treatment of those patients. I was coming from the world of clinical trials. I had worked in multiple drugs in development in the field of cardiovascular, CNS, diabetes, and I thought, okay, I leave my comfortable jobs at a big pharma, and I launched. And the first year has really been about doing fundamental research to see how we could passively observe the state of the patients. And so I said, we started with stroke. I used it for myself, and I'm still using it to follow my father's evolution. But when thinking about the business, we had to take some detours, and when exploring the best options with for development and to make really a big difference with neurologists, they told us that migraine would also be something where they really needed help. We did explore stroke, spinal stenosis, epilepsy, and at some point they really told us, yeah, but we have those tons and tons of patients with migraine we cannot help, and you've built already that platform. Can you use it for migraine? And I knew something about migraine. Somebody else in the company also knew about migraine, and we said, yeah, obviously, because migraine is really misunderstood. It's actually 12% of the world population, and it's coming far earlier in the life of people. And we thought, if we want to do serious predictives, AI, machine learning, at the time we were calling it machine learning, we need to have data, relevant data. And going into migraine also made sense there. Not only will we be able to help a billion of people, we will also be able to train massive models that we will be able to reuse in other diseases. That's how we went there. That's how we decided to focus on that disease that which is not necessarily fancy, which is not necessarily the best to fundraise, because you know that VC people are mostly male and migraine is mostly women. But it's also something where we could have a massive success and be and grow to where we are.